Hello, this is Dr. Gay from First Look MRI. And this is a 60-year-old female who has complaints of right shoulder pain. She's had surgical intervention of biceps tenodesis, where they reattach the biceps tendon right here. You can see the biceps in the front. There's an anchor. She also had a rotator cuff repair. And to get some anatomy here, we see that the humeral head is this round ball. On this view, we're slicing from the top. Here's the very top above the shoulder, down, down, down. Now we're down into the axilla. So from top to bottom, we call this axial imaging. Axial slices, the front is here, here's the back, here's the outside of the shoulder to get oriented, here's the body towards the medial side or inner side here. So the anatomy is a round ball. The humeral head rotates in this cup here called the glenoid. And the glenoid is part of the scapula. The scapula is a really big bone, and it has a cup here where the humeral head rotates. It also has a finger-like projection that wraps around in the front called the coracoid process. So this is the coracoid process. You can see this thumb goes towards the inner, laterally, and also hooks towards the humeral head, which is not normal. And also, this coracoid process is too close to the humeral head. Normally, there's a distance of about 11 millimeters here. In this patient, it's about 5 millimeters. So this is called the coracohumeral interval. And the space is narrow because of this coracoid process hooking backwards. And when this is narrow, part of the rotator cuff called the subscapularis, here's the subscapularis muscle. The tendon comes sideways, and it's going to attach right over here on the lesser tuberosity. And right at the attachment, there's brightness in that tendon. Normally, tendons are dark. And on this view, that's almost normal. That's abnormal, very bright. And on this view, it's almost normal. So there's just very localized partial tearing or tendinopathy of the subscapularis tendon at the insertion. And this is what we call coracoid impingement, or some people call it subcoracoid impingement, but it's the coracoid process, that long finger-like projection of the coracoid process being too close to the humeral head. The space is narrowed, this coracohumeral interval is narrowed, and you get pinching of the subscapularis tendon, especially when you internally rotate, and they can get tendinopathy and tearing. In this patient, they just have tendinopathy, and this may contribute to some of her pain because everything else looked very good. Just this one other finding. The average space here is about 11 millimeters in people, and when people have symptoms, the average distance supposedly is more like 5.5 millimeters. And this patient was less than 5 millimeter gap here, so it's very narrow, and so it would go along with coracoid impingement. And they usually like to treat this conservatively with non-steroidal inflammatories. But if it gets really bad or this tears and they have to go and repair it, then they'll resect part of the coracoid process here. And just a minor anatomical point, this coracoid process, you wonder, what is this doing? Well, there's a couple tendons that come off that or muscles. So the biceps short head comes off of that and it joins with the biceps long head here. There's another muscle here called the coracobrachialis that comes off as well. And they again, the two components blend together, hard to separate. But again, this is a case of narrowing between the coracoid process and lesser tuberosity of the humerus, causing pinching of the subscapularis tendon. And again, we call this coracoid or subcoracoid impingement. Thank you very much.